So my background basically is I started out, I'm a nurse practitioner. I currently own my own practice, NP Wellness Care. I provide hepatitis C treatments to residential and addiction treatment centers to the clients there on site, meeting an untapped need. And my business is growing, and I'm getting requests from other facilities who are hearing about what I'm doing. So that's very exciting. My other hat I wear is I'm the CEO and co-founder of the National Nurse Practitioner Entrepreneur Network, which is a national organization that helps nurse practitioners cultivate their business brains. We do not get this education and training. And in order to be successful entrepreneurs, we really need to have the foundational support of business, but also reducing barriers that NPs face when they open up practices. And my other hat that I wear is NP Business Consultants. That is my business where I do education and training about coding, billing, and documentation. And that's where my journey started as a nurse. I worked on a cancer floor, and I was tapped by the local oncologist to start outpatient chemo. And at the time, this was in the early 80s, and I said, well, either, if it doesn't work, I'll just go back to the hospital. That was the pillar of job security, no issues there. But I stayed for 20 years. And what I learned as a nurse is that was the start of my entrepreneurial journey, because I had to figure out what new chemo treatments were, research them, cost them out, how much labor, how much for supplies. Then I had to negotiate with the payers to pay for the treatments. So I did not know at the time, but as I was moving in this direction, I started to advance what I was doing as a nurse and felt I needed to go back and get my NP. So that's what I did. I went and got my nurse practitioner. In my last semester, I said to my professor, are we going to learn about CPT and ICD codes? And she goes, what's that? And this was in the late 90s. And I'm like, oh boy, we're in trouble. So I took that opportunity to write an article about coding, billing, and documentation called Understanding the Reimbursement Process that got published in the Nurse Practitioner Journal in May of 2000. So that really started my journey to really talk more about the business side of being a nurse practitioner. My policy went parallel and hand in hand. One of my mentors when I was going through my clinicals for my nurse practitioner, worked in a community health center. And she was very interested. She was an entrepreneur. She started a community health center locally. And she brought me to a couple of meetings of this group of nurses that got together on a monthly basis and started looking at policy issues. So, and they had been working previous with lots of legislative change. So I started there probably in about the time I finished, around 1997, 98. And when I went to these meetings, they were very contentious. Like everybody was fighting to get their agenda items on the plate. And, it was really not a cohesive group that was working together. So that I found was very interesting as an observer coming in. But she brought me to the meetings because she saw something in me, a leadership potential. And she thought that I would be interested in learning more about policy and how we could affect change, knowing my background. So moving forward, we had a couple of legislative wins. In 98, we got out of supervision as APRNs, which was great. But then, as time moved on, we really needed to define our scope. So as I was going through my policy journey with this coalition, and the coalition consisted of the Connecticut Nurses Association, all the specialty disciplines. So there was geriatric, there was midwives, there was pediatric, psychiatric, and then the Connecticut APRN Society. So these were the core group of folks that got together on the monthly basis. So fast forward, the person that was heading up the coalition was actually retiring from clinical practice and moving to Idaho. So she said, Lynn, I think you would be great taking over the committee. And I go, me? I'm going to do this? And she said, yeah, you can do this. And she mentored me for the first, 6 months or so as she was transitioning out of her role as the chair of the coalition. And then I ended up taking it over. And one of my mottos as a leader is to really, I'm a transformational nurse leader, but also a democratic one. And I think one of the problems with the group was we really needed to come to consensus if we were going to have any legislative wins, and how could we make that happen? And what I really fostered around the table was everybody being able to discuss what the issues were, how they were going to impact their particular organization, and how can we work together as a unit to support whatever legislative agenda we wanted. So as a result of that, in 2013, we got full practice authority in the state of Connecticut, and part of that was due to the ability of the coming to consensus of all of our disciplines and putting together a scope of practice review, which ultimately got passed and became our legislation. It wasn't easy to do this, and I was driving home from one of the coalition meetings, and I'm like, how am I going to get these group of people together to make any positive impact on this scope review that we had coming up? And I heard Katy Perry's song Roar on the radio. And I just said, you know what? That's going to be our mantra. Let them hear our roar. So every time that we had anything that came forward, we would use the term roar, let them hear our roar. And then I said, well, the next thing is we need to speak with one voice. So how can all these different organizations speak with one voice? And at the time, the CRNAs were part of our group, but the anesthesiologists were a very hardy bunch, and they still remain that day to this day. And they would oppose any type of legislation that was going forward. So because of that, the CRNAs decided to carve themselves out of our language for the greater good of getting it passed. So we ended up having a scope review, and the scope review committee came together as a result of the public health committee's bogged down of turf wars between the physicians and the different other disciplines. And they decided that they didn't have enough time to spend on issues that were affecting other aspects of healthcare delivery. So what they decided to do was carve out a scope review process. So if somebody wanted to advance their scope, there was a process by which we could put in an application, and then from the application, we would get impact statements from organizations, and they would say, yes, they support, or no, they don't. And what that did is it gave them seats at the table for when we went for our discussion about scope of practice. So ours got selected in 2013. We had 42 people around the table. So each person that had an impact statement got 2 seats at the table. And each of the medical societies submitted impact statements. So you can imagine how many physician groups were around the table at the time. And we had our nursing colleagues. And the nice thing was, in preparation for this, we all got together and we strategized, like, who's going to present on education, who's going to present on economic impact, who's going to present on previous legislation. So we kind of had it really laid out, like what our responsibilities were. So nobody was going to get caught off guard. And before we went into the first meeting, a bunch of us got together and we just said, just give us the right things to say at the right time so we can make a good impact for the health of the residents of Connecticut. And what we were asking for at that time was full practice authority. So that's what the gist of all this discussion was going to be about. So here we are, 42 people sitting at the table. And this, mind you, this was the first scope of practice review. Nobody had ever done this before. The legislation had just passed this, and we were the first ones. So the director of public health says, okay, Lynn, let's start the scope review. You have the floor, because I was the chair of the coalition at the time. So I took a deep breath, and I basically just said, the collaborative agreement is nothing more than a piece of paper that sits in a desk drawer. Well, the lobbyist for the physician group stood up, red-faced as can be, cogwheeled his arm around, slammed it on the desk, and said, it is much more than a piece of paper that sits in a desk drawer. And thus, the discussions began. So it was quite interesting, but each one of us owned a share of that. And I think that showed strength at the table where these discussions were happening. And so we had 3 different meetings, and there was nothing that the medical society brought forth that was powerful enough to make a case that we weren't qualified. We had 2 binders in front of where I sat at each meeting, full of all the studies that show we're safe clinicians, and the medical society had 3. So 100 versus 3. And we had a physician champion on our group who basically took those 3 studies and ripped them to shreds. So they had so it's 100 to 0 as far as safety and efficacy and safe practice. So that was really good. And the scope review, we got a favorable report coming out of the committee, and it then starts the legislative process. So now you get a bill, and then you have to go through the House and then the Senate, and then they vote on it, and the governor signs it, and it becomes law. So that process took quite a bit of time. And in between all of this, at the last hour, one of the members of the Public Health Committee, who was a nurse, worked with the Medical Society, because the Medical Society was not happy that we wanted full practice authority. They wanted us to be under supervision. And this nurse kept saying, no, they have been out of supervision since 1998. We cannot have that in there. So as a compromise, she negotiated 2,000 hours and 3 years of practice under a physician collaboration. And then after that, we could have full practice authority. And so she came out of the room and gave that information to us, and we go, why'd you do that? We would have never have settled for that. We wanted to be part of the discussion. And she said, well, I'm sorry, you're going to have to take it or leave it. So obviously we took that, but that was in 2014. It's 10 years. And we still we have not added APRN to that legislation, though we've had many, many bills come forward. So that kind of gives you an idea of what's been happening. But I think because of that 10-year gap, we're finding out how important it is to have our colleagues engaged in policy, that they have to be engaged with their legislative officials so that they understand what we do, who we are, what we do, and how we do it. And we have to have our presence. We have to be at the Capitol when these sessions are happening so the legislators see us and they can ask us questions. So those are some of the things that we've tried to do in that 10-year window to help further our case. I appreciate it. Well, thank you, everybody. It was great to connect on a Saturday, and happy Mother's Day to the moms out there.